Welcome to the second part of our discussion about microscopic examination of urine. Okay, so the first sediment constituents that we are going to discuss is the red blood cells. Okay, so I am sure that you are all aware that our red blood cells are non-nucleated cells and appears as biconcave disc. No? Siguro naman, you were able to see the structure or how does our RBC looks like in the under the microscope, no? When you prepare your smears, well, of course, in hematology, in hematology and during your PMLS days, you were able to prepare the slides or the smears as well as in your community and public health. That's why I am sure that you are all aware of how does our RBC looks like. Ngayon, sir, you might ask me, sir, is it the same is it the same structure or appearance that we can see under the microscope for urine? Well, of course, yes. No? Ano yun, nabago yung itsura ng RBC under the urine because mapanghi, because of the ammonia-like odor of the urine? No, it is not like that. However, well, possible. Possible if the urine is hypertonic. Okay, mataas po yung concentration sa urine na naging crenated ang ating RBC. No? Crenated, ano ibig sabihin? Naging rugged yung kanyang structure, pamangit. Okay? That is crenated RBC. We also have what we call ghost cells, no? Hindi yung mga nanggo-ghost, no? Ghost cells is RBC, no, in the urine if the urine is hypotonic urine. Okay? Next is dysmorphic with dysmorphic RBC is an indication of glomerular bleeding. That's why if there is a significant amount of RBC in the urine, the doctors are requesting for the presence of dysmorphic RBC. No? How much of the RBC is dysmorphic? To know if there is a glomerular damage. Okay, so normal range of RBC in the urine is 0 to 2 to 0 to 3 per HPF. Okay, so this is our RBC. No, hindi po siya bilog-bilog lang. No, kitang-kita mo po yan, no, na RBC. Biconcave non-nucleated disc. Next is WBC, larger than RBC or past cells, no? Past cells or white blood cells is larger than WBC. Is larger than RBC. My God. Okay? Mas malaki po ang WBC natin kaysa sa RBC. And kung si RBC, no, non-nucleated, kung si RBC ay biconcave disc, donut shape, or donut-like, no, si WBC po, meron po siyang mga granulations, meron po siyang lobes, no? Multi-lobed. Okay? And take note guys that WBC is present, no, sa may mga infections. Kasi kung kay RBC, meron tayong tinatawag na prenated RBCs at meron tayong tinatawag na dysmorphic RBC. Meron din tayong tinatawag na ghost cells. No, kay WBC po, meron tayong tinatawag na glitter cells. At kapag naman po glitter cells, that is the WBC in hypotonic urine. No? Take note, this is what I am telling a while ago in the previous video or in part 1 of the video. Eosinophils with greater than 1% is considered significant because that is an indication of what? Allergic reaction or acute interstitial nephritis. Okay? That is an indication of allergic reactions or acute this is a renal disorder which will be discussed in the next topic. Okay, so again, take note guys, The presence of eosinophils, 1% of eosinophils, is considered significant because that is an indication of uh, allergic reactions and, of course, acute interstitial nephritis. Okay? So for WBC, the normal range is ano ba't nawala? Okay? For WBC, the normal range is 0 to 5 or 0 to 8. Okay? 0 to 5 to 0 to 8 is the normal WBC in the urine. Okay? So the next one is epithelial cells. Epithelial cells in the urine is classified into three rather. We have the squamous epithelial cells, which is considered as non-pathological and considered as normal. We also have the transitional epithelial cells, so that can originate from the urothelial cells or the urothelial lining of the kidney. And of course, we have the renal tubular epithelial cells, which is an indication of tubular damage. The presence of RTE suggests the presence of tubular damage. Okay, so let's discuss first the squamous epithelial cells. This is the largest cell that can be seen in the urine sediment, no? And it originates from the linings of the vagina, for female of course, urethra, and lower portions of the male urethra. Again, this is considered common. Ngayon, kailan lang siya nagiging significant? Nagiging significant ang squamous epithelial cells kapag po mayroong presence ng tinatawag nating clue cells. Okay? Ulitin. Nagiging significant po ang ating epithelial cells or squamous epithelial cells if there is what we call clue cells. What is this clue cells? Clue cells are squamous epithelial cells. Okay? Clue cells are squamous epithelial cells, and on the cytoplasm of these squamous epithelial cells are like a sunny side up egg. No? On the squamous epithelial cells or on the cytoplasm, excuse me, on the cytoplasm of squamous epithelial cells, there is a bacilli or bacteria, no, that is considered as pathological. At sino pong bacteria yan? Gardnerella. Sulat ko ng husay. Tapos pag narong spelling kayo, sasabihin nyo, ako ang mali. Ay, may pa nga pala. Gardnerella vaginalis. Okay? So, squamous epithelial cells with this bacteria ingested on the cytoplasm is what we call clue cells, and that is true with Gardnerella vaginalis. Okay? Please take note of this one. Okay? Epithelial cells or squamous epithelial cells is considered not significant or not pathological. However, the presence of squamous epithelial cells with ingested microorganism on its cytoplasm is an indication of bacterial infection, vaginal bacterial infection, Gardnerella vaginalis. Okay, ang tawag po doon, clue cells. Okay, so we have here, no, we have here your squamous epithelial cells, again, like what I've said, excuse me, like what I've said, that is a larger or the largest cells that can be seen in the urine. This one, if you will ask, no, I know you are, tawag dito, sige Mark, kaya mo yan sir, you are uh, curious, okay, of what is the cell. Ala, anong nangyari? Okay, sige, tumawa kayo. Kainis. What is this cell? This is our CaOx or calcium oxalate. This is an example of WBC. Okay, this is transitional epithelial cell. Yeah, another WBC here. This is a larger WBC than this one. This is not Entemiba histolytica, ha? Okay, and this is RBC. This is an example of another calcium oxalate. This is an example of RBC. This is WBC, epithelial cells. Then the rest are just confusers. Okay, so this is what we call clumps of squamous epithelial cells under 400 magnification. This is transitional epithelial cells, no, irregular po ang shape ni squamous epithelial cells, no, irregular po ang shape ni squamous epithelial cells. However, si transitional epithelial cells are somehow spherical or polyhedral or caudate in shape, no. This is another example of clump squamous epithelial cells. And this is a cova-stained spherical transitional epithelial cells, no? Which is different from this one. Tignan mo, perfect po yung kanyang pagbilog, while for squamous epithelial cells, irregular po ang kanyang cytoplasm. Okay, so when we said transitional epithelial cells, that is spherical, polyhedral, and caudate with centrally located nucleus. Si squamous epithelial cells, yung kanyang nucleus po is irregular din. What I mean regular, kung saan-saan pong side pwede siyang makita. Unlike ni transitional epithelial cells, no, yung kanyang nucleus is only seen at the middle, no, centrally located nucleus. Well, of course, ito minsan nasa center, pero minsan din nasa tabihan. Unlike kay transitional epithelial cells, no, nandun lang po siya sa gitna ng cytoplasm. Okay? That originates in the renal pelvis, calyxes, and ureters and bladder. So that's why the presence of transitional epithelial cells is considered significant, because that originates on the upper, no, urinary tract infection. Okay? So how about for renal tubular epithelial cells? Of all epithelial cells, this is the most clinically significant, because the presence of this one is an indicative of necrosis. And that what we mean by necrosis, destruction on the structural pattern of the tissue, and because of the what we call the tubular injury or tubular damage, no. So greater than 2 RTE per HPF is considered tubular injury and should be tested or should be evaluated further, no, para malaman talaga if there are or there is a presence of tubular injury. Okay, again, remember, this is the most clinically significant epithelial cells, no, followed by transitional epithelial cells, followed by the clue cells. Again, remember, yun pong ating squamous epithelial cells is not considered clinically significant. However, it will become clinically significant or pathologically significant if there is what we call bacteria on the cytoplasm, ingested bacteria on the cytoplasm. Okay? Next is we have the oval fat bodies, which is a highly refractive RTE, no, which contains cholesterols, no, and the Maltese cross formation. Take note, kapag po sinabi sa iyo Maltese crosses formation, that is your oval fat bodies. Next in line is bacteria that can appear as small spherical or cocci, no, and rod-shaped bacilli structure that can be seen in the urine. Now, for spherical shaped bacteria or the cocci, I want you to take note that that is mistaken as amorphous, no? Amorphous kasi appears as sand-like structure, para mga bilog-bilog din in the microscope, under the microscope. Okay? But you must observe, no, for the presence of amorphous and spherical bacteria, kay cocci. Ngayon, mas common or common po yung mga rod shape. Common ang spherical, no, meron din mga rod shape. Example of a rod shape bacteria or bacilli, No? Let's make it bacilli. Example of bacilli that can be seen in urine is the Escherichia coli or E. coli. Okay? So, please take note guys that Escherichia coli ha, hindi Entamoeba coli. No? Escherichia coli. Okay, that is the most common cause of uh, urinary tract. Ano URT? That is the most common cause of urinary tract infection or lower urinary tract infection. Okay? Escherichia coli is the most common cause of lower urinary tract infection among females. Okay? Another bacteria that can cause urinary tract infection common is the Staphylococcus. I know you hate this subject, but you have to love this. No, Staphylococcus saprophyticus. Mali ata spelling ko. Saprophyticus. Let me check it. Nakakaya namang mali ang spelling. I will just validate the spelling of saprophyticus for a while. Okay. It spells as ay, tama naman pala ako. Okay. So that is Staphylococcus saprophyticus. Okay. This is the most common cause of UTI from Staphylococcus family. Okay. From the Staphylococcus family. Okay. So again, remember, no, you must be careful in examining the presence of bacteria and the presence of amorphous phosphates or amorphous urates. Now, remember this guys, bacteria cocci is non-motile, no? Non-motile yan. So, bakit po sila gumagalaw? Sometimes because of what we call the Brownian movement. Okay? Kaya po nagalaw po yung mga cocci po. Pero hindi sila motile kasi wala naman silang flagella. Okay? Next is, again, bacteria is correlated with nitrate, pH, leukocyte esterases, and WBC. Okay, so Candida albicans, present po. That is a yeast, no? Candida albicans is a yeast, no? Which is present in a patient with diabetic diabetes. Okay, yeast, okay, that is a small oval reflective structures with buds or budding and mycelia, yung pong mga filamentous structures ng ating yeast, no? It is sometimes mistaken as RBC because halos sila ay parehas. Pero si yeast, spherical din kasi siya or pabilog, no? Pero wala po siyang hindi po siya biconcave. Okay, and yeast is correlated with glucose, leukocyte esterase, and WBC. Okay, so I don't know if this is visible in your screen, but I hope this is. Okay, so ayan, napalaki ko naman. Okay, so these are an example of bacilli that can be seen in the urine. Okay, bacilli yan. Okay? O yeah, this is cocci. This one, a cocci microorganism. This one is a yeast, a budding yeast, no? As you will observe, kung wala po itong portion na to, that could be mistaken as RBC. But since we have this one, okay, this one, no, the buds, that is considered your yeast. That will give us a clue that is a yeast. And this one, filamentous structures, no, these filamentous structures are what we call the mycelial structures that can be seen in the urine. Okay? So, as per parasites, no, akala nyo wala na si parasites, but parasites is still there. So, we have here Trichomonas vaginalis, Enterobius vermicularis, and Schistosoma hematobium. So, we all know that Trichomonas vaginalis and Schistosoma hematobium is seen talaga, no, originally seen in the urine. As per Enterobius vermicularis, that is only on contamination, or if the urine is, or if the urine have a fecal contamination. But please take note of this. Trichomonas hominis can also be seen in the urine. Okay, so these are the most common parasites that can be seen in the urine. Okay, so kung matatandaan nyo pa, si Schistosoma hematobium, meron siyang terminal spine. Kaya siya ay nagkakos din ng hematuria, no? May terminal spine. Okay? Spermatozoa, so this is the structure, or how does the sperm looks like under the microscope. Well, don't worry, we'll have the experiment on this so that you will be able to know how it looks like. So that is the sperm, no? Remember guys that the presence of sperm in the urine should be reported based on the laboratory protocol. Okay? Well, of course, for young female, no, single young female na mayroong presence ng sperm should be reported, because for medical legal or instances, or baka po siya ay victim ng rape. Okay, mucus threads, this is not considered as significant naman or pathologically significant, but however, since this is a urine sediment, so we have to you have to take note of how does the mucus looks like. Okay, so this is a single or clump threads with a low refractive index. That's why you have to lower down the intensity of light if you are testing for urine sediments, no? And take note that mucus threads is sometimes mistaken as a hyaline cast. Okay, now cast. Okay, what is cast? Cast is the only element that can be found in the urine sediment that are unique to the kidney. Meaning to say, this cast will only be seen in the urine. Cast will only originate to the kidney. That's why the presence of this cast is an indicative of renal damage. Okay? Remember guys that the matrix, or the backbone of cast is what we call horsefall protein, or formerly known as the uromodulin. Okay? That is found in the lumen of the distal convoluted tubule. Kaya po, kapag po tayo ay mayroong cast, there is a problem on the distal convoluted tubule. Anong problema? May sira. Anong problema pag may sira? Impaired ang reabsorption. Okay? So, the cast composition information, again, uromodulin, no, is the backbone, is the protein structure of our cast. That is the formerly known, or the former known, or the old term, no? And the new term is the TMF, the Tom Horsfall protein. Okay? And take note guys that uromoduline is increased in cases of stress and exercises or exercise. Ngayon, uromoduline is also seen in transient appearance of hyaline cast kapag po mayroong stress and exercises. No? Stress can be physical stress or physiological stress. And number one is we have the hyaline cast. So I have here already the summary of what is hyaline cast and what is the clinical significance of hyaline cast. Okay, so the appearance of this is a colorless homogeneous matrix. Again, the backbone of this is uromoduline or the Tamhurst-Full. The sources of error for hyaline cast is mucus threads, fibers, hairs, and increased lightning. Kasi nga, colorless. So kapag po taas ang intensity ng light, no, mahirap pong makita ang ating mga hyaline cast. And the urinalysis correlation should be correlated with protein. So definitely, nandiyan talaga si protein. Mataas si protein because of the presence of cast. Kasi nga, siya yung backbone. Okay? The blood and the color of urine. Usually, hyaline cast is correlated or clinically significant kapag po mayroon presence ng hyaline cast. So I will zoom it so that you will be able to see. Okay? Kapag po may presence ng hyaline cast, this is the hyaline cast, no? Another here, this one, hyaline cast, no? Hyaline cast correlated or clinically significant with pyelonephritis, chronic renal disease, congestive heart failure, stress, and exercise. Ngayon, si stress and exercise is just a physiologic stress, no? Okay, so this is our hyaline cast on phase contrast microscopy. Next in line is we have the RBC cast. So the source of error for RBC cast is the RBC clumps. Kasi kung as you will see, no, if you're going to compare with hyaline cast, medyo hindi po siya staggered, no, hindi po siya hiwa-hiwalay. Unlike here in your WBC cast, it appears orange-red cast matrix containing RBC. That's why that is sometimes mistaken as RBC clumps. Okay? So the clinical significance of this is glomerulonephritis and strenuous exercises. Definitely, strenuous exercises is an example, no, ng not pathologic condition. Pero yung glomerulonephritis, well, definitely, that is a pathological condition. We have here WBC cast, no, and as well as your RBC cast, ang kanyang source of error is the WBC clump. Okay, and it is clinically significant with pyelonephritis and acute interstitial nephritis. So for bacterial cast, that is sometimes mistaken with granular cast. Definitely, the urinalysis correlation is the WBC cast, the WBC, the leukocyte esterase protein, and bacteria. And the most common renal disorder wherein you can see bacterial cast is pyelonephritis. Okay, so epithelial cells is an RTE cells attached to the protein matrix. Okay, so RTE cells attached to the protein matrix is how our epithelial cells looks like. Okay, and that is clinically significant with renal tubular damage. Diba sabi natin yung RTE correlated sa renal tubular damage or sa tubular injury. Then of course, our epithelial cells will also be correlated with our renal tubular damage. We have here granular cast. No, the appearance is a coarse and fine granules in a cast matrix. Okay, clinically significance with glomerulonephritis, pyelonephritis, and stress as well as exercise. Okay, so this is our granular cast. Okay, another granular cast. Waxy cast, that is a highly refractive cast with jog ends and notch. So meron siyang parang mga sira. Yan. That is our That is our waxy cast. Okay? And that is clinically significant with stasis of urine flow. So may problema sa urine flow and chronic failure. Chronic renal failure or CKD. Okay? Next is we have the fatty cast. Fatty cast is appeared as a fat droplets and oval fat bodies attached to the protein matrix. And take note guys that fatty cast is sometimes mistaken as a fecal debris because of its appearance. Okay? And fatty cast is correlated with nephrotic syndrome, toxic tubular necrosis, diabetes mellitus, and crush injuries. Ano po yung crush injuries? Ano yung magkagusto ka o sa injury ka? Well, bahala ka kung ganun ang gusto mo. Pero yung crush injuries po, yung mga na-aksidente. The next is we have the broadcast. No, hindi po ito si Ted Final or si Lloyd de Castro or kung si Melchang Kung sino man broadcaster po yun. No? Nag-joke na naman po tayo ng isang walang kwenta at hindi na naman po tumawa ang sambayanan. Kapag po sinabi nating broadcast, that is a wider than the normal cast. And the source of error for this one is the fecal materials and fibers. Take note guys that broadcast is correlated with extreme urine stasis and renal failure. I have here a recall from our board exam. The question is like this. Which of the following can be a broadcast? A. Knowledge Castro. No, joke lang po yun. Which of the following can be a broadcast? A. Hyaline. B. Granular. C. Waxy cast. The answer will be all of the above. No? Si hyaline, si granular, at saka si waxy cast can be a broadcast. No? And this is the kumbaga the chronological order. Kapag na-develop, okay? Granular cast may be developed into waxy cast may develop into fatty cast may develop into a broadcast, which means waxy, granular, and fatty cast can be a broadcast. Next question, most common type of cast. The answer for this one, please take note of this, the answer for this one is granular and waxy cast. Okay, so this time we're going to discuss urinary crystals. But before I leave cast, I take note guys that cast is considered as clinically significant. No? Clinically significant po ang presence ng cast sa urine. And the presence of cast in the urine should be, or the determination of cast in the urine should be done in a right manner. No? The intensity of light should not be too high in order for us to detect the presence of the cast. Sometimes, hindi po sila napapareport. Kaya po, akala yung result ay simpleng urine or simpleng renal disorder lang. Okay? So, if you will be a registered medical technologist working in the urinalysis section, then please specify or please examine your urine sample accordingly. Okay? Now, we have here urinary crystals. Take note, guys, that crystals can be considered as normal or abnormal, but there are only few abnormal crystals. But even though there are only few, they are all considered as significant or pathologically significant. Okay? Well, for the other cast, for the normal crystals, they have rarely clinical significance. Okay? And take note of this. Ito po yung mga magaganda. Mas madaling i-identify ang urinary crystals as compared to cast. Because of cast is sometimes they look like the same. No, since their matrix is the protein. Okay? Kasi po yung urinary crystals natin, meron silang they appear as a true geometrically formed structure of amorphous material. Okay? So, without further ado, so let's discuss our urinary crystals. Number one here is how our crystals na-form. Okay? That's actually formed by the precipitation of urine solutes. And these urine solutes includes inorganic salts, organic compounds, and medications. Okay? So, then sila na-form. Example, ascorbic acid. O, nagpo-form sa ascorbic acid ng mga crystals. Si Caox, nagpo-form ng ascorbic acid. Okay? And formation of crystal may also due to the precipitation uh, or the precipitation is subject for change in the temperature, the solute concentration and pH, precipitate at low temperature, room or ref, and crystals abundant in refrigerated urine. These are the reasons why kung bakit po hindi naman natin nakikita agad-agad ang ating mga urine crystals because of that. Okay? So for identification of techniques, okay, for identification of techniques, we must consider the pH. Why? Because there are there are acidic crystals and there are alkaline crystals. Polarized microscopy will be helpful for determining the crystals. No solubility. There are crystals when you dilute in acetic acid will be diluted. Mawawala sila. Masisira sila. Okay? And their ability to polarize light. The example of a crystal that can polarize light ay sino? Si uric acid. Ang gandang uric acid sa polarized microscope. Okay? So, sabi ko po sa inyo, there are normal crystals in acidic urine. That is amorphous urates, calcium oxalate, and uric acid. Okay. ACU. Para hindi mo malimutan na si amorphous urates, calcium oxalate, at uric acid ang acidic urine, AC acidic urine. Bahala kayo kung nagets nyo. AC acidic, AC acidic urine. Acidic urine crystals, amorphous urates, calcium oxalate, and uric acid. Take note guys that amorphous urates is different from amorphous phosphates. Amorphous urates, acidic, amorphous phosphates ay sa phosphate sa alkaline urine. Okay, so let's discuss first amorphous urates. Amorphous urates is a pink sediment because of the uroerythrin or a brick dust sediment. No? Ito po ay napo-form sa ating urine. Usually, nagfo-form po, nag-trigger no, ang precipitation ng ating amorphous urates kapag po na-precipitate ang ating urine or nagkaroon ng precipitation because of refrigeration. Okay? Take note guys that amorphous urates can be converted to acetic acid with acidification with acetic acid. No? Si amorphous urates ay pwedeng maging uric acid upon acidification with acetic acid. So ano pong ibig sabihin nun, sir? If you have here a urine sediment with this amorphous urates, no, and you want to furtherly identify if that is really amorphous urates and you have plenty of time, then you can add a drop of acetic acid or glacial acetic acid, no, to acidify the reaction. At kapag po yung amorphous urates na nakita mo turns into a uric acid, no, a four-sided polygon, then that is your amorphous urates. So, bakit hindi sa uric acid? Ay kasi nga sa amorphous urates ay pwede maging uric acid kapag nilagyan mo ng acetic acid. It's a confirmation that that is the presence of amorphous urates. Intende. Okay? Next, amorphous urates is dissolved with heat at 60 degrees Celsius and with diluted or dilute alkaline. Next in the line is we have here a uric acid which is rhombic, wedge, rosette, hexagon, and a four-sided plate. And sometimes uric acid is called as the whetstone. Please take note of this: uric acid, whetstone, rhombic, rosette, wedge, and hexagonal four-sided plate. Okay? Uric acid is increased in cases of Leishman's disease, or also known as the diaper's disease, no? Gout, uric acid, right? Gout, no? Leukemic patients receiving chemotherapy. Okay? So this is the structure of uric acid, and this is what I'm telling you. Uric acid is a good example of a crystal that can polarize light. Di ba ang ganda? Okay? Uric acid, uric acid. Next in line is the calcium oxalate, or sometimes called as the CaOx. Take note, people, that calcium oxalate appears as envelope or a oval. No? Appears as envelope or oval shape. And sometimes, ang pong ating CaOx ay dumbbell shape din. No? It can be a dumbbell shape. No? Envelope. Kapag nakakita ka ng envelope structure, that is your CaOx. Okay? Calcium oxalate is usually increased in patient with increase in consumption of ascorbic acid or oxalic. Okay? Because that is the major contributor of the formation of the CaOx. And take note, guys, that calcium oxalate is also the most common matrix that involves lithiasis. Ano yung lithiasis? Ito yung mga stones in the urine. Okay? Stones in the kidney. I'm sorry. Stones in the kidney. Stone formation or lithiasis formation. Okay? Calcium oxalate will also be possible or will also be seen in patient with ethylene glycol poisoning. Okay? Typically, calcium oxalate is wedelite and wewelite. No, kapag po wedelite, that is the envelope shape. No, envelope shape, wedelite. Makikitandaan naman. Wedelite, envelope shape. Wewelite, ang papanghe, no? Wewelite, that is the monohydrate, calcium oxalate, and that is our dumbbell shape. Sometimes, yung pong ating calcium oxalate ay tinatawag ding hourglass. Bakit po siya tinatawag na hourglass crystal? Kasi po yung structure niya parang ganito. Ano ba yun, sir? Hindi naman yun hourglass eh. Yan. So, parang hourglass ang ating calcium oxalate. And kapag po hourglass, that is our wewelite. Kapag naman po monohydrate, dumbbell, that is our wewelite. No? Sometimes, calcium oxalate may be seen in all pH, but usually, it is seen in acidic pH. Okay? So, this is our monohydrate calcium oxalate, wewelite. This is our dumbbell shape. Okay? This is a dumbbell shape na calcium oxalate. Okay? This is na gawa-gawa, no? Talaga po nakakakita ng mga ganang structure. And once in a lifetime lang, ikaw makakakita ng mga dumbbell shape sa iyong buhay. This is the wedelite, no? The calcium oxalate envelope shape, no? Now, how about the normal crystals in alkaline urine? Amorphous phosphates, ammonium biurate, triple phosphate, calcium phosphate, calcium carbonate. So, paano daw natin matatandaan AATTCC? Ang sabi ng mga estudyante ko before, Traffic, Calamba City. Okay? Traffic, Calamba City. Yun daw yung palatandaan para matandaan na yung mga kung sino-sino ang ating mga alkaline urine. Traffic, Calamba City. Amorphous phosphates, ammonium biurate, triple phosphate, calcium phosphate, and calcium carbonate. Okay, so amorphous phosphates appears as a granular appearance and a white precipitates, no? Kagaya po ni amorphous urates. Okay, so amorphous phosphates, alkaline urine, amorphous urates ay acidic urine. So kung nakakita ka ng amorphous-like structure at hindi mo alam kung urates or phosphates, tingnan mo po yung iyong pH. Kung acidic, edi urates. Kung alkaline, that is phosphate. Now, how about ammonium biurate? No, ammonium biurates is sometimes called as the thorny apple. So, makinig ng husay. Ammonium biurates is sometimes called as the thorny apples. Okay? Because of its appearance with this one. Now, ammonium biurate is an indication of an old specimen, and a presence of ammonium biurate in the urine should be uh, asked for recollection because it means that the specimen is old. Okay? It dissolves in heat at 60 degrees Celsius and acetic acid. Okay? Appearing as typically uric acid crystals after 20 minutes. Okay? Take note, ammonium biurate is a yellow-brown structure that can be found in the urine, which is an indication of an old specimen. Ammonium biurate is also an indication of a thorny, old specimen and sometimes called as the thorny apples. Okay? And it dissolves at heat at 60 degrees Celsius and with glacial acetic acid or acetic acid and appears as typically a uric acid after 20 minutes of uh, acidification. Okay? Triple phosphate no, is called as struvite. No? Sino nga yung whetstone? Uric acid. No? Whetstone uric acid. Struvite, triple phosphate. Wewelite, calcium oxalate. Wewelite, monohydrate. Wedelite, dihydrate. Wewelite, dumbbell shape. No? Wedelite, envelope. Okay? Now, don't be confused between triple phosphate and calcium oxalate. This is triple phosphate. No? Don't be confused with this because sometimes they are, if you will look at first glance, they look the same. But if you are going to observe it, there is a line no, on the triple phosphate. That's why triple phosphate is sometimes called as the coffin lid structure. Yan. Ganito po si si calcium oxalate. This is calcium oxalate or CaOx. Si triple phosphate is a rectangular or rectangular or square structure, no? At yanan siya. Para siyang coffin lid, no? This is triple phos. No? Ito po ay coffin lid. Kabaong. Anong lid? Lid. Ano ba spelling mo? Basta coffin lid. Okay? Ayun, LID. Tama naman pala ako. Next is we have calcium phosphates, which appears as colorless flat rectangular plates or thin prisms, often a rosette formation. Dilutes with acetic acid. And take note, guys, that calcium phosphate resembles sulfonamides. And take note that sulfonamides is an example of abnormal crystals, which will be discussed later. Okay, so please take note kung ano ba talaga, kung calcium oxalate, kung calcium phosphate po ba siya, or sulfonamides. Calcium carbonate naman is a small colorless with dumbbell or spherical shape. So, si calcium carbonate, pwedeng dumbbell. Si calcium oxalate ay pwedeng din pong dumbbell and spherical. So, please take note of this. Kapag calcium carbonate, saan mo siya makikita? Alkaline. Kapag calcium oxalate, saan mo siya makikita? Acidic. Okay? Again, formation of gas after addition of acetic acid. Now, these are our abnormal crystals. Cysteine, cholesterol, tyrosine, leosine, and bilirubin. Okay, cysteine is a hexagonal shape. No, the presence of cysteine in the urine is called cystinuria, and the presence of cysteine in the urine is an indication of impaired renal absorption of the amino acid cysteine. Cholesterol is a rectangular plate with knot. Ayan. And sometimes this is called as a staircase pattern. And cholesterol is an indication, the cholesterol crystal is an indication of lipiduria. And lipiduria is an indication of nephrotic syndrome. We have here tyrosine, which appears as a colorless to yellow needles, okay, which appears as a colorless to yellow needles, and that is an indication of liver diseases. Okay? So, yan po ang ating mga tyrosine. Next, we have here leosine. Appears as a yellow-brown spears with radial striations. Sino nga yung parasite na mayroong radial striations? Correct. Ang galing mo talaga. Sino? Si Tania. Okay? Leosine and tyrosine may occur together. Okay? And take note guys that leosine may precipitate with tyrosine if alcohol is added. So para malaman mo kung talagang leosine yan, maglagay ka ng alcohol, magpiprecipitate po yan to tyrosine. At anong itsura ni tyrosine? Para pong mga needles. Next is we have here bilirubin, no? I clump needles with a yellow color. So definitely kapag makakakita ka nito, dapat positive din sa bilirubin ang ating urine. Okay? We have here the sulfonamide. This is the last, no? Which is seen in patient treated with urinary tract infection because of the antibiotics. Sulfonamide. Diba? Antibiotic. May mga ganung antibiotics po tayo. No, and the presence of sulfonamides is an indication of inadequate hydration, and the presence of sulfonamide is an indication of tubular damage. And take note guys that the sulfonamides is sometimes called as the sheaves of wheat. Kumpol ng mga trigo. Sheaves of wheat. Okay? So, those are our abnormal crystals, normal crystals, cast, and our urine sediments, which you must observe properly in the urine comes that you will perform urine analysis. Okay? So thank you for listening, and I hope you learn in this lecture.